Hello, everyone. Welcome back to Healthy Habitat, the place where your health and well-being are our top priority. Today, we're diving into a topic that's incredibly important for many men out there, dealing with an enlarged prostate. But here's a twist. While our title, Just One Medicine to Damage an Enlarged Prostate, might sound like we're focusing on a single solution, we're actually going to explore the top 6 medicines that can impact your enlarged prostate. Surprised? Let's unravel this mystery together. An enlarged prostate, medically known as benign prostatic hyperplasia or BPH, is a common condition as men age. It can lead to uncomfortable urinary symptoms and, if not managed well, can significantly impact your quality of life. But did you know that certain medications, while intended to help, can actually cause more harm than good to your enlarged prostate? So today, we're starting from number 6 and working our way down to the medicine that tops this list. By the end, you'll have a clearer picture, and hopefully we can clear up any confusion you might have. 6. Calcium channel blockers. Starting our countdown at number 6, we have calcium channel blockers. Now, these are usually the go-to meds for controlling high blood pressure. But here's where it gets interesting for men with BPH. These blockers, while great for your blood pressure, can have a less than ideal effect on your urinary symptoms. It's like a trade-off, managing one health issue but potentially aggravating another. The mechanism is quite complex, involving the relaxation of muscle tissues, which can impact the bladder and urinary flow. It's a classic example of how interconnected our body systems are. Guys, if you're on these medications and noticing some changes in your bathroom routine, it might be time for a chat with your doctor. It's all about finding that sweet spot where your heart and prostate health can coexist peacefully. 5. Non-steroidal anti-inflammatory drugs, NSAIDs. Number 5 brings a common household medication into the spotlight. NSAIDs. Think ibuprofen and aspirin, your go-to pills for that annoying headache or back pain. But did you know that their long-term use might have a hand in developing BPH symptoms? Here's the deal. Regular, prolonged use of certain NSAIDs has been linked to an increased risk of BPH symptoms. It's a bit of a head-scratcher, isn't it? These drugs reduce inflammation, sure, but they might also influence hormones and blood flow in a way that doesn't play nice with your prostate. So if you find yourself reaching for these pain relievers often, it might be worth discussing alternative pain management strategies with your doctor. Remember, it's all about keeping every part of you, including your prostate, healthy. 4. Certain antidepressants and antipsychotic medications. At number 4, we're looking at a group of medications that play a crucial role in mental health. Certain antidepressants and antipsychotic medications. Now, mental health is paramount, but for men with BPH, these meds can sometimes complicate things. Some antidepressants and antipsychotics can interfere with urinary function. It's a bit like a traffic jam in your body's signaling pathways. These medications can affect the muscle tone and nerve signaling in the bladder and prostate area, sometimes making it harder to urinate or worsening existing urinary symptoms. It's a delicate balancing act between managing mental health and prostate health. If you're on these medications and notice changes in your urinary habits, it's definitely worth bringing up with your healthcare provider. They can help navigate the complex interplay between these medications and your prostate health. Testosterone products. Number 3 on our list is testosterone products. Now, testosterone replacement therapy is something a lot of men consider, especially as they age and their natural levels start to dip. But here's where it gets tricky for those with an enlarged prostate. Testosterone can actually stimulate prostate growth, potentially making BPH symptoms worse. It's like fueling the fire in a way. This doesn't mean you should immediately shy away from testosterone therapy if you need it, but it's a clear sign that monitoring and careful management are key. So if you're considering testosterone supplements or are already on them, keep a close eye on your urinary symptoms and have regular check-ins with your doctor. It's all about finding that balance where you feel energetic and healthy without putting extra pressure on your prostate. 2. Diuretics. Taking the second spot are diuretics. These are often prescribed to help the body get rid of excess fluid, especially in conditions like heart failure or high blood pressure. But here's the catch for men with an enlarged prostate. Diuretics can make you need to urinate more frequently and urgently. Imagine this. Your bladder's already under pressure from BPH, and now you've got a medication that's increasing your trips to the bathroom. It's like being caught between a rock and a hard place. While these meds are important for managing certain health conditions, it's crucial for men with BPH to discuss with their doctors how to balance this increased urinary frequency with their prostate health. There might be alternatives or adjustments in dosage that can ease the situation. 1. Decongestants and antihistamines. And finally, at number 1, we have decongestants and antihistamines like pseudoephedrine or diphenhydramine. Commonly found in cold and allergy medicines, these might seem harmless enough, right? But for men with an enlarged prostate, they can complicate things. These meds increase muscle tone in the bladder neck and prostate, making it tougher to urinate. It's like a door that's not fully open, making it harder for urine to pass through. This can worsen the urinary symptoms of BPH, a real issue if you're already struggling with these symptoms. It's important to be mindful when reaching for that cold medicine off the shelf. Always check the labels, and if you're unsure, have a quick chat with your pharmacist or doctor. It's about finding relief from your cold or allergies without adding stress to your prostate. And there you have it, our detailed countdown of the top 6 medications that can impact an enlarged prostate. It's fascinating, isn't it, how medications meant to help us in one way can have unexpected effects in others. The key takeaway here is communication. Always talk to your healthcare provider about any concerns or changes you notice, especially when it comes to your prostate health. They're your best guide to balancing your overall well-being while managing BPH. Remember, knowledge is power, but the right application of that knowledge is what truly makes a difference. Thanks for joining me on Healthy Habitat. If you found this information helpful, don't forget to like, share, and subscribe. Stay informed, stay healthy, and see you in the next video.